Great. It is a pleasure to be here with you today. My name is Dr. Doug Micalizzi, and I am an instructor of medicine at Massachusetts General Hospital in Boston, Massachusetts. And I'm very excited to talk with you today about breast cancer screening and early detection. And so I will jump right in. So first of all, I have no financial disclosures here. And I wanted to go through first a little bit of background about breast cancer in the US in particular, and some of the facts about the incidence of breast cancer. And so to start with, that is a figure shown here, looking at the #1 cancer diagnoses in the United States. And so you can see this is broken down into men and women, and you see that breast cancer here is the most commonly diagnosed non-skin cancer in women in the United States, with 31% of the total cancer diagnoses being breast cancer. In addition to breast cancer diagnoses, it is also a cancer that unfortunately is a lethal cancer, and it is the second most leading cause of cancer deaths in women in the US, with about 15% of those women dying of cancer dying of breast cancer. But it's important to know that not all breast cancers are the same. And so this is an important point that I'd like to illustrate here. And so this looks at the different stages at which a breast cancer can be diagnosed. Early stage breast cancer, generally considered stage 0, stage 1, and stage 2. These are breast cancers that are confined really to the breast or to the surrounding tissue of the breast. Whereas more advanced or late stage breast cancer, what's called stage 4 breast cancer, is where it has spread to distant sites within the body, the organs of like the lungs or the liver or the bones. And so an important point here is that breast cancer can be diagnosed at any of these stages, but the earlier onset, or the earlier that we catch it, the earlier stages, is really a key part of how well we can treat it and how well the chances that we can cure it. And so this is really then demonstrated on this slide here, looking at a number of cancers that we screen for. So lung cancer, colon cancer, and breast cancer. And on the side here shows the 5-year survival of individuals diagnosed with breast cancer at an early stage, so stage 1. And we can see that almost all of the women will be still alive after 5 years with a breast cancer diagnosis. However, that substantially decreases at the latest stage. So if a woman is diagnosed with stage 4 breast cancer, then only around 3 in 10 of those women are going to be alive at 5 years. And so we can see that this varies somewhat compared to other cancers too, colon cancer and lung cancer in particular. There are still a number of early onset lung cancers or early stage lung cancers that still, unfortunately, can be lethal, and actually a greater proportion of women and men will die of lung cancer at the later stages. So here, though, you can see with breast cancer, really the concept of why it's so important to catch breast cancer at an earlier stage. So nearly all cancers have a significantly increased survival if diagnosed and treated early. And this is really a global problem across the whole world, and particularly in resource-poor areas. And so this is, I think, demonstrated in this figure, looking at some of the inequities in breast cancer deaths. And in high-income countries, being diagnosed with breast cancer means that after a 5-year period, about 9 in 10 of those individuals will still be alive. However, in other places in the world, in India, it's about 6 out of 10 will survive, and in South Africa, about 4 in 10. will survive. And so you can see, again, there's certainly improvements that I think we can make in the US, but across the world, the early detection and then ultimately the treatment is really key to improving then these outcomes in women and in men diagnosed with cancer.